Further ado, I would like to welcome to our group Dr. Vicki Montesano. She will be presenting on systems of care in the mental health world from the perspective of being the Bureau Chief of Mental Health Treatment at the Ohio Department of Mental Health and Addiction Services. Vicki, welcome and thank you.
Thank you. Good afternoon, everybody. As I was putting this together, I was thinking about the best way to kind of look at, I tailored the presentation from like globally down to kind of through the state, taking a look at what is in the community. So I'm hoping that this will be helpful to everybody on the call or on the in the webinar. Let me ask you to advance slide. I think it's going to end up being 2. So I'm going to start with the state overview. So kind of looking globally at what is happening at a state from a bird's eye perspective from the state level. Next slide, please. So if you look across with the governor and the different cabinets, I realized when I was just looking at it, I don't know if you saw me flipping through my pages, we actually have 27 departments now. So that 27th department is brand new. It's the Ohio Department of Children and Youth, and it is led by Director Kara Wente. And there will be individuals who will be coming from the different departments. We'll have, Department of Mental Health and Addiction Services. We'll have individuals from Department DYS, Ohio Department of Education that will end up going to that particular department that's dedicated to children and youth. So I do not know a timeline right now, but that is definitely a priority of the governor. So just kind of looking across the 27 different departments, and for each of the individuals who lead those departments, for example, at the Ohio Department of Mental Health and Addiction Services, we have Director Chris. There's a dedicated director or commissioner, and those individuals don't have a term like the governor. They could potentially be replaced with the new governor, or they could resign their terms. There have been a couple, for example, Mike Hogan was one with the Department of Mental Health and Addiction Services who carried into a different governor. So these individuals, they answer directly to the governor. They're part of the executive branch, and they do have authority to enforce the laws of Ohio directly. So with our department, we've been doing a lot of work around Ohio Revised Code, and making sure to update and modify different laws that directly impact individuals with mental health and addiction. Next slide, please. So this is just a list of the different departments as our cabinet level agencies. As I mentioned, the 27th is not listed here. And I'm just going to point out the obvious that there is a Department of Mental Health and Addiction Services, and then there's also the Department of Developmental Disabilities, which brings us to this conversation today. And how do we bring the work together that we have been doing? I know from the department level, we've been working with the Department of Developmental Disabilities. I have personally, over the past 4 years, trying to make sure that we're coordinating care for individuals who are dually diagnosed. Andrea is aware, Dr. Whitwer is aware that we created a training series to try to bridge that gap between the Department of Developmental Disabilities and Ohio MOS, to kind of cross-pollinate the training, and that is what Nissanger is doing as well. So with the hope that we can cross-pollinate with both of the departments to more effectively serve individuals who are dually diagnosed. Next slide, please. So Ohio is a home rule state. Home rule means that the particular counties, if you go from one county to the next, you will not see the same thing. Some of the counties have, as we're coming up on voting in November 4th, some of the counties have mental health levies. So there are particular counties in the state that have quite a bit of money, a lot more flexibility to provide services, and others that do not. As you look again at home rule, they have each county has local government. They have their own police powers and ownership, their own operation of public utilities. So from a department level, we can, as we allocate funds to the different counties, we can say you would use the funds for a particular purpose, but we can't tell them how to actually use the funds. So again, thinking about how to effectively serve individuals who with dual diagnosis, it would, each of the individuals who present, if they come from one county, it'll look one way, if they come from another. So it's kind of relearning every time we go into a different community because of this home rule. Next slide, please. If you can move to the next slide. Sorry, I jumped ahead and had mentioned that about mental health levies. So just a little bit of a historical overview. So almost 2 centuries, I'm sure, I have a feeling many of you already know this. Looking at the first asylum, so it was approved in 1837, and then in the Kennedy administration, the Community Mental Health Act, the idea was individuals would be taken out of institutions and would receive services in the community. I don't know if you've heard Governor DeWine mention that, the system was not built. And that is specifically what this is about, where individuals were released from different psychiatric facilities, placed in the community. There has not been a really solid system for these individuals, and we definitely are building it. So in 1967, there at that time were 53 local mental health, the different drug abuse boards. I don't want to go over every single piece of this. 1988, the idea was to serve individuals where they live, deinstitutionalize individuals. There will be a couple slides that we're going to get to in a minute. There are right now 6 state-run regional psychiatric hospitals. So those, in personal statement to me, I think of those as almost a parallel to the 14 adult psychiatric, the hospitals that individuals were discharged from historically. Next slide, please. Okay. I'm sorry. So 2013, it is important to note that the Department of Alcohol and Drug Addiction Services and Mental Health, we merged at that time. So that was really a very pivotal moment in time, because historically, then you had those 2 departments, which you had to cross-pollinate between those 2 departments, just like we do with Department of Developmental Disability today. So we have definitely merged as of 2013. Thank you. Brief data on mental illness in Ohio, looking at serious mental illness. So if you look at the actual definition of serious mental illness, I'm going to jump right to the examples: schizophrenia, bipolar disorder, severe major depressive disorder. Those are the severe and persistent mental illness. So as you look at the population of Ohio, we have about 11.7 million individuals in the state. We've got about 4.5% of those individuals who are diagnosed with a severe mental illness, that's a lot of individuals, 525,000 people. So then as you look at any mental illness, that is the spectrum, DSM-5 spectrum of mental illness. So any mental illness, diagnosable mental illness, ranging from mild to severe impairment. Next slide, please. And so you don't have to move slides, but just to let you know that I do not have data, Dr. Whitwer, I don't know if you have data on individuals who are the number of individuals in Ohio with co-occurring disorders. I don't know that that data exists at this time.
No, there's not that. Dr. Tassay, we're doing a big study looking at point prevalence nationally. It's not been done. We've got data on folks who've been hospitalized for psychiatric diagnoses, and I could pull that out and report that back to the group. But I don't think that we know, especially not just necessarily those being served by one like Medicaid system. So we don't know those numbers yet.
Which is really important. And I guess I'm going to make an assumption as I state this, that even if we had the numbers, my guess would be that they would be grossly underestimated because of difficulties diagnosing mental illness among individuals with a developmental disability. So we do have a lot of work ahead of us. So I just wanted to, again, drill down. So this is an overview of our department. Next slide, please. So the Ohio Department of Mental Health and Addiction Services, it is cabinet level. Director Chris reports directly to Governor DeWine. And again, as I had stated previously, it was a result of the merger. So we have a central location. We call it the State Office Tower. It is down on Broad Street. As you can imagine, when COVID came, we all dispersed. We worked from home. Today, we need to be at the State Office Tower or another government facility at least 2 days a week. So we do focus on planning, policy writing, funding, and licensing. Almost 1,000 facilities statewide. So I'll be honest, when I came to the department, that was a little bit of a learning curve for me. We do a lot of grant making. We receive federal grants, federal funding, SAMHSA grants. We also have a line item where we're able to use funding for planning, policy writing with the general revenue funds. And we work with local communities, and then keeping in mind, again, I know I stated it a couple times, but that home rule does make it a little bit difficult to do something consistently, implement consistently across the state. Next slide, please. So our mission is to provide that statewide leadership of a high quality mental health and addiction prevention, treatment, and recovery system. So our values are to contribute and collaborate, serve compassionately, deliver quality, and be accountable. Under Director Chris's leadership, we have really worked hard with the communities. I don't know that it was done as intensely as it is being done right now to make sure that we are partnering with not only the local Adams board that I'll mention in a minute, but also the providers. Director Chris is very invested in customer service and making sure that we are all working together to create that system that is effective and valued by all Ohioans. Next slide, please. So I've had different people ask me for a table of organization. You can find it on our website. It's kind of like a hunt and peck activity when you try to look for it. So as of today, just to give you an idea, many people are confused about who they need to talk to at the department. So you have Director Chris, Recovery Ohio. I don't know if you're familiar with Recovery Ohio. Governor DeWine, it was one of the first things that he signed in order when he became governor. So Recovery Ohio has done a lot of work around the addiction, in the addiction arena. The group looked at overdose rates in Ohio. They've done a lot of work with opioids and naloxone. A lot of their work parallels what our department is doing as well. So there are 3 key people who report to the director. Jonathan Baker is our chief of staff. Jamie Carmichael is a community planning and collaboration assistant director, and Lois Hostetler is community treatment services assistant director. So the entities that you would most likely engage with would be under Lois Hostetler. So you have the Substance Abuse Treatment Bureau, my bureau, the Mental Health, Criminal Justice. That work is with the different jails. That particular bureau chief works with the different jails across the state, and then specialty dockets like the mental health specialty dockets in courts, children, youth, and families, and then correctional recovery services. So those are the services in the prisons, and the focus is on substance use. So there are others under Jamie Carmichael. So you have recovery supports, which would be probably the main one that you would be ever interact with. So that would be our housing, that's our peers. We have a certified peer right now where individuals across the state can work in different arenas as long as they have certification through us. Grants management, you can go on our website, you can look at available grants that are there. And typically they post the grants, well, all of our grants, but if specifically, if there is like a SAMHSA grant, and if interested, you could check on more information in that queue. So the other pieces, I mean, we have licensure and certification that's on the left-hand side. if you know of a facility, if you come across a facility that if there is a problem that you've noted, you can go to our website and look and see if they are licensed and certified through our department, and then reach out to that group if there are ever any problems with a specific facility. So I don't think there's anything else. Oh, one more, PASSAR. So if you're not familiar with PASSAR, PASSAR is a group of individuals, so a county or like a nursing home can ask for an evaluation of an individual to find out about placement, ideally placement, for example, in a nursing home. A group of individuals from the PASSAR team would do an evaluation and determine whether or not the individual would be appropriate for a nursing home or other placement. And if not, then the local alcohol, drug addiction, mental health services board is notified. Thank you for the, Andrew, notification. Next slide, please. So as mentioned previously, we have 6 state-run regional psychiatric hospitals. So the Appalachian Behavioral Healthcare, bottom right-hand corner, and the Heartland Behavioral Healthcare in red, that has just recently changed. There are a couple more locations that have been added to the Appalachian Behavioral Healthcare region. So just kind of thinking about globally, within those hospitals, there are individuals who are dually diagnosed. When there is a question about diagnosis or treatment, the hospital is contracted to reach out to the Wright State University Mental Illness Intellectual Disability Coordinating Center of Excellence to come and do a referral. They do a referral, and then Dr. Gentili's group will do an assessment on the individual. Next slide, please. Excuse me. So very briefly, the hospital serve both civil and forensic patients. So those individuals who have not been involved in the court are considered civil patients. The community can place them in the hospital. And then for the forensic patients, the court oversight where they need to be placed in the state hospital. Next slide, please. Just an overview. This is a quick overview of our priorities, the Ohio MAS priorities. And just looking at these were under Director Chris's oversight, that these were the priorities that have been put in with this administration. Next slide, please. Next slide, please. So right now, as of today, we have 50 local alcohol, drug addiction, mental health services boards serving the 88 counties. So some of those boards are combined. If you have an individual in a particular county who needs services, I am recommending that you reach out to the local ADAM board. So this, the Ohio Association of County Behavioral Health Authorities, I had embedded the link. You can go to their website. Next slide, please. And you will see this map of Ohio, and it's interactive. You can click on one of whatever county, and it will let you know what local ADAM board is there. So the counties have ADAM boards. They also have local developmental disability boards, and not all work together. So just kind of keeping that in mind, that's a lot of the work would be to bring all of the partners to the table. We have tried, and we have been working on bringing multiple partners to the table in a number of different initiatives, but I wanted to direct you to this. So it is a WACABA. You identify a client who needs, or an individual who needs services. You click on that county, respective county. It will give you the local ADAM board and the link, the URL to their website, and you can get the information you need to be able to contact them. Next slide, please. So I wanted to share with you, there are different things that are available to individuals served. So this is a more recent one that is quite good. And my staff member, Liz Poprocki, has done a number of presentations to local DODD boards, local DD boards, the Department of Developmental Disabilities in particular, trying to get the news out that the Access to Wellness Project, originally in the state fiscal year 22-23 biennium, there was $11 million in this biennium. Another $1 million was added to it. 45 county ADAM boards participate. So if you have somebody who needs services, you go to a WACABA, you find out your local county, you can ask that county board whether or not they participate. So the department provides an allocation directly to that board to administer this program. Next slide, please. So criteria for it, and let me jump to the bottom. The per client cost is $8,000 per year. And if the individual needs more than $8,000 per year, an appeal can be created with Liz Poprocki to ask for additional money. So kind of thinking about what is available to these individuals, $8,000 is a lot of money to be able to provide security stability to somebody. So when the criteria was created, we were looking at 2 or more psychiatric hospitalizations within the past 12 months, and that individual needs to be involved in another system. So DODD and Ohio MAS, those individuals are appropriate for to receive the funding. So up to $8,000 as you work with the individual. So we had also added 2 or more crisis stabilization unit stays, and so DODD was one of the partners in kind of formulating what this would look like. And we would get feedback that many individuals with a developmental disability would not end up in a hospital. They would often end up in a crisis stabilization unit. So making sure that we were looking at the possibilities of where these individuals might land. So if an individual has involvement in an outpatient competency restoration program that is in lieu of the hospitalization, or if the individual was currently in jail and diagnosed with a significant mental illness, but they also need to be involved in that other system. So you have one individual involved in at least 2 systems, and then meeting these other criteria: hospitalization, stabilization unit, competency restoration, or in jail. Next slide, please. So I tried to talk really fast through that. Hopefully I hit my limit. Andrew?
Perfect. Thank you, Dr. Montesano, for that great comprehensive overview of the department and services, with a lot of great resources and direct actions that we can take in order to connect people with the services and resources that they need. I'd like to invite everyone in our group to think about questions that they might have, to raise your hand if you'd like to present a question, or you may enter a question into the chat box for us to consider.
So as people are thinking, Jody, I do see your hand. I see a couple hands. Let me just say to the group, if you go on our website, the Ohio Department of Mental Health and Addiction Services website, there are other resources that are available too. The Access to Wellness with Liz Poprocki, she's amazing and can get you to other possible resources too. So just thinking about all the different ways that you can get help. Jody, I saw your hand raised first.
Hi, thank you. So I just recently had a case with an individual who spent, I believe, 190 days in an acute facility because there was no place to go from the acute facility as a step-down unit because he couldn't go home. And when you have an individual who is a young person, didn't have any other sort of income or anything. So of course we didn't have housing, possibly respite, but also that wasn't a safe place. So are they going to start to address something, what they called was a PRTF, which doesn't exist.
Mhm.
They say they have it. We found one in Vermont and we found a similar facility in Minnesota, but of course Medicaid doesn't go that way. So I'm wondering, is that in progress? And then is that going to help our individuals? Because, you know, you find more people with intellectual disability that has a mental illness diagnosis also. And sometimes they say they're not appropriate for mental health because they have an ID diagnosis.
So, gosh, I heard a number of questions in there, but let me tell you more globally. For the group, PRTF is Psychiatric Rehabilitation Treatment Facility. So that is for 18 and under. The department is in the process of finalizing rule for PRTFs, and yes, they will be available in the state. I will be 100% frank and say I was involved in earlier conversations and the way that they were being developed. So I'm not sure if each PRTF will have specific populations that they will serve. But I will say that is in the queue, and I just heard recently that the goal is to start opening this service in November, which is this month. Hopefully we'll see some movement pretty quickly.
And what about that next age group? Because 19 to like 23,
Right.
there's so little for them too. I'm telling you, I spent that in 190 days searching for answers for this family because they wanted that psychiatric key that developmental centers don't always have access to.
Mhm.
And so it was a big fight. I'm sure you may have heard of my case, possibly.
So the transition age youth population most certainly is a difficult population that has more specific needs. And I don't know the answer to the question, Jody. So I don't want to speculate. I'm sorry.
That's okay. Thank you. It's good to know that at least one age group, but I would love to see that next age group find some service because that's still really a tough age. They don't always have benefits yet. They don't have job skills, and mental illness inhibits those things also. So
Right. And from the department perspective, we have rolled out supported employment for 18 and above, and we're in the process of working on a project that would include the transitional age youth population. And as you can imagine, it will need to be modified, not significantly, but modified somewhat for that population because of their needs. So there is different work that is happening. We also have a multi-system youth project that is happening. I'm hoping that some of you are involved in that group of individuals who come together and try to talk about cases and implementation.
yeah, we had some key pieces of them involved. These were like 25 people meetings to try to help this person. So it was tough.
Thank you, Jody, for encouraging that discussion. Nicole, you have your hand raised.
Yes. So, Vicki, I have a client that accessed the Access to Wellness funding. So my question is, she didn't use the 8,000. She's in a DC now. Would she be able to access other of that funding when she gets out, or would that, because it's been about 6 months?
So you're at NetCare, so you would need to talk with the Franklin County Board, correct?
Yeah.
Just because somebody comes in and out of services doesn't prohibit them from using the funds. So
Okay.
I am going to say no. In fact, individuals can be served over multiple years.
Okay.
And Liz Paparocki, again, is the contact to work with.
Great. Thank you.
Nice to hear that you're using the funds. I appreciate that.
Yes.
Great. Thanks, Nicole. Just a couple questions here in the chat from Andrea. Are there published guidelines on how the funds from Access to Wellness can be spent?
So they should be on that link that Dr. Whitwer just put up there. I don't know if somebody wants to fact check me on that, but Liz just redid that whole webpage. So criteria should be there.
Great, thank you. And yes, Andrea has posted a link in the chat to the Access to Wellness website for everyone. And then Aaron asked as well, and I think this was touched upon, is the Access to Wellness limited to adults or youth as well? And you had mentioned transition-aged youth. Any other clarification on the target population here or who can receive this service?
So 18 and above.
Great. I'm not seeing any more questions. I want to thank you again for a great presentation, and I want to thank our participants for encouraging the discussion during the Q&A. If you have additional questions that come up, please put them in the chat or send them to our team so that we can continue to follow up. I know, Vicki, you may need to leave to another meeting. We're going to move into our case presentation, but